Top 5 myths about bariatric surgery debunked. One of the most common myths about bariatric surgery is extreme. It's not for me. Bariatric surgery is a very common procedure, particularly the sleeve gastrectomy these days. Most patients are not somebody that you would look at and think that they're a candidate for weight loss surgery. Some of these shows on TV that patients are often watching thinking, oh, those are the patients that need surgery. Those are patients well out of the realm of what we typically see for weight loss surgery. So it is definitely not considered extreme in a very common measure to treat illnesses from obesity like diabetes. Surgery is dangerous. That's another myth about bariatric surgery that needs debunked. Bariatric surgery is one of the most safe surgeries that I personally perform. I perform a wide variety of different operations in my practice, and bariatric surgery is one of the safest surgeries that I perform. It's also one of the most common surgeries. One of the newer operations now, the sleeve gastrectomy, which is the most common weight loss surgery done in the United States. It is by far the safest weight loss operation, and its safety profile has a risk of serious complications of well less than 1%. That safety profile matches almost every other operation or is better than any other operation that I perform. A common myth about surgery is, why should I have bariatric surgery if I can lose the weight on my own? We've done studies looking at this, and it's been known for decades now that if you lose weight on your own, great, I fully support that, but the question is, can you keep the weight off permanently? Studies have shown patients that lose weight on their own, when I say lose weight on your own, I mean without the assistance of surgery, you have a risk of regaining that weight 95 to 100% of the time. A recent study where we looked at several thousand patients showed that at about 100% of the time, you have regained the weight over a 1-year period after ending the plan. So that's the problem, is you might have a plan that works for you and you can lose the weight, but temporarily losing the weight really doesn't affect your longevity in life or your illnesses that occur with obesity in life. If you look back at over your lifespan and say you lose a good 50 pounds and then within a year you regain that 50 pounds, in the end, losing that 50 pounds really doesn't make a big difference because you've regained it. And with that regain, you get all the illnesses like diabetes, hypertension, arthritis, lifestyle change that come with obesity that shortens your lifespan. Bariatric surgery is the failure of an individual. Patients will often present saying that they feel like this is a failure or they're cheating by having weight loss surgery. And that is one of the largest myths I see and completely inaccurate. Bariatric surgery is by no means a failure and definitely not cheating. I think one of the problems that we're facing with the population of patients that have obesity is their set point runs higher than thinner individuals. And a lot of the times there's multiple factors involved that are involved with creating that set point. And so the only way that we can truly lower that set point is basically where your weight wants to be in your adult life. And it slowly moves up over the years. And it's basically set by your genetics, environmental factors, physiologic factors, several factors at play. But what we do know is the only way you can lower that set point is a weight loss operation. Anything else that you do, lifestyle change, even medications, any temporary measures, that won't permanently change that set point. And so patients are constantly fighting to keep the weight off if you don't have a weight loss operation because their body never forgets that set point. And then myth number 5, bariatric surgery is just as effective as the newer medications that are out. These are the injectable medications called GLP-1 agonists. And we now have studies looking at a comparison of the two. And the answer is no, they are not effective. Weight loss surgery has always been and will always be the most effective method for permanent weight loss. The medications cause, on average, and again, this is grouping a lot of different medicines together, but on average, somewhere around 15% total weight loss, I'd say within a 1-year period while you're on the medications. With surgery, we see about twice that amount, or a 30% total weight loss, and that's over about a 1 or 2 year period to hit your target after surgery. So on average, and sometimes you've got a little bit higher weight loss, maybe up to 20% total weight loss with the medications, but then in a 1-year period, about half of those patients will gain it back. So over, I would say about half of the expected weight loss with the medications compared to the operation that we do for weight loss. Thank you for watching. If you have any further interest in what we have to offer for weight loss surgery, please subscribe to our channel.